4, 3, 2, 1.
Your first procedure in the Arizona Aesthetics Practical Exam will be your setup and client protection. You have 15 minutes for this procedure. They will read you the instructions.
Verbal instructions. You will now set up the general supplies that you will use throughout your examination. You will also set up the cleansing and steaming supplies and perform proper draping. You will be observed for client protection, safety, and infection control procedures. You will have 15 minutes to complete this section. You will be informed when you have 8 minutes remaining. Number 1, the instructions will be repeated. Number 2, you may begin setup.
At this point, you will always follow their instructions. So if this video is teaching you something and you go to State Board and it's different, always follow their instructions. Make sure that you're wearing a white lab coat. Make sure that you have your admissions paper and your photo ID. So let's go ahead and get started with our setup. They have read the instructions and we have 15 minutes. So the first thing you're going to do is you're going to take your suitcase and you're going to put it on the side of your table. If they tell you that the suitcase does not belong on the table, you will have to empty your suitcase from the floor. Okay, so the first thing that we're going to do is we're going to go ahead and unzip our suitcase. And I'm doing it in front of the camera, but the suitcase will actually be to your side, okay? So I'm going to unzip it. I want to make sure that my suitcase opens up away from where I'm going to set up. I'm going to first take out my soil bag and I'm going to place it under the table. The soil bag should have writing that says soil bag on it on both sides. The next thing that I'm going to do is I'm going to go to bag number 1 and I'm going to pull out 1 paper towel and my disinfectant wipe. Push my suitcase to the side and I'm going to clean the area that I'm going to set up on. So I'm going to lightly spray it. I hold on to my cap, I don't lay it down. With my paper towel, I am cleaning the table. I take my paper towel and I drop it into my soil bag, and I take my disinfectant and I put it back into bag number 1. Now I am going to take out my hand disinfectant and I'm going to sanitize my hands over my soil bag. And now that my table is clean, I can lay down my disinfectant. I'm in bag number 1. I'm going to go ahead and pull out my table cover. The table cover has been cut to the appropriate size as required, and I open it up and my hand sanitizer now goes onto my towel, my cover. So now at this point, I'm just going to take out everything from bag number 1 and I'm ready to set up. I take out 1 paper towel and it's folded in half. If you're using a 3-ply, that's fine. And underneath this paper towel, I'm going to put the rest of my items, my tissue, my paper towels, and any other items that you have in this bag. Once you take it out, you close. Make sure that your suitcase remains closed the whole entire time. You take this bag and you're going to throw it into your soil bag by dropping it, taking your pump sanitizer and sanitizing your hands. I'm now going to open up and I'm going to take out bag number 3 in the same order. I'm going to open it up. I'm going to take out all the items in bag number 3 and place them under my paper towel. Close it, throw the bag, and sanitize your hands. I'm now going to take bag number 5 because remember, bag number 4 is your product, which is already set up. From this point on with bag number 5, 6, 7, 8, 9, 10, it remains in the tray. So you're just going to take out the whole tray. Make sure the labels are facing you. You're going to put the tray on your table setup. In the back of this tray, you want to put your sanitizer and your disinfectant just so that they don't fall. You're also going to take out your product, which is already pre-set up for you. You are going to take out your mannequin. And the last thing that is in this kit is your 3 towels. So you're going to go ahead and take out your 3 towels and situate them on your table setup. Take your suitcase. It should be empty by now. Nothing extra should be in your suitcase. Take your suitcase and place it under your table setup. You want to sanitize your hands because now we're ready to drape our model. In draping your model, you're going to apply the sanic strip, the headband, the cape, and the bouffant. Place the bouffant on the head as such. You can do this laying down or you can do it with your mannequin up. You're going to take the headband and you're going to place the headband on your client as well. Our next procedure in this Arizona State Board Aesthetics Practical Exam is cleansing and steaming the face. You have 10 minutes.
Verbal instructions. You will now perform the cleansing and steaming the face section of this examination. You will be observed for client protection, safety, and infection control procedures. You will have 15 minutes to complete this section. You will be informed when you have 8 minutes remaining. Number 1, the instructions will be repeated. Number 2, you may begin. Candidates will be evaluated on the following tasks. Preparation. Removes cleanser from container using infection control procedures. Demonstration of cleansing the face. Cleanses lips completely and safely. Cleanses eye area completely and safely. Distributes cleanser over entire face safely. Cleanses without dragging or pulling skin. Removes all residual makeup and cleanser safely. Demonstration for client protection, safety, and infection control procedures. You will have 15 minutes to complete this section. You will be informed when you have 8 minutes remaining. Number 1, the instructions will be repeated. Number 2, you may begin. Candidates will be evaluated on the following tasks. Preparation. Removes cleanser from container using infection control procedures. Demonstration of cleansing the face. Cleanses lips completely and safely. Cleanses eye area completely and safely. Distributes cleanser over entire face safely. Cleanses without dragging or pulling skin. Removes all residual makeup and cleanser safely. Demonstration of steaming the face. Wrings wet towel thoroughly. Tests towel temperature on wrist prior to applying. Drapes towel to cover face, ensuring nose and or mouth are uncovered. Lifts towel from face safely. Applies toner or astringent safely. Safety and infection control. Disposes of soiled materials using infection control procedures. Practices infection control procedures safely throughout service. Maintains work area in a safe manner throughout service. You may begin.
Once you have instructions to begin, the very first thing that you're going to do, of course, is to sanitize your hands. So again, you want to pump it over the soil bag. And now that your model is laying down, you never want to go over the face. You always go around the face. In this procedure, the very first thing that we are going to do is we're going to remove the lip and the eye makeup. We're going to be doing that using makeup remover. The important thing to point out is that you are going to have to double brace. So I will demonstrate the double bracing. You're going to take 3 cotton pledgets, cut in half, as such. You're going to put them together. Over your soil bag, you're going to saturate them with your makeup remover. You're going to hold the lid in your hand. Do not lay it down. Squeeze out the excess product over your soil bag, put your lid back on, and put it back in your table setup where it belongs. At this point, you have 3 cotton pledgets that are ready to apply your makeup remover, which we did. So at this point now, we're going to apply the cotton pledgets to the eye and lip area. We're going to start by approaching the body, taking 1 cotton pledget in your hand. You're going to go around the face, brace. Your first bracing is on the eyebrow. Your second bracing is going to be on the cheek. You're going to drop your cotton onto the eye with your finger remaining on the cheek and using your little finger to hold it. You come back to the approach position. The second eye, bracing, bracing, drop, and hold. You have 1 cotton left in your hand. You're going to take it and you're going to wrap it around your index finger with the opening at the top. You're going to take your left hand and brace the left side of the corner of the mouth. You're going to take your little finger on the right hand and brace underneath the chin. You're going to clean the lips from corner to center, top and bottom. You go back to your approach position, turn over your pads on your index finger. Right hand, the right side, the right corner of the mouth. Little finger braces on the chin, corner to center, corner to center. Now you've completed the lip cleansing. You're going to take your cotton round and that gets dropped into your soil bag and sanitize your hands. Come back to the approach position. brace on the eyebrow, brace on the seek. Grab your cotton, wrap it around your index finger, and now you're going to clean the eye shadow and the eye area. To do so, you are going to go 1, 2, 3, from the inner corner out, outer corner in, and then up on the bottom lashes. Once again, 1, 2, 3, outer corner, in, and up on the bottom lashes. You drop your cotton into the soil bag and you sanitize your hands. Approach position, brace, brace. 1, 2, 3, out, in, and up. Drop your cotton into the soil bag and sanitize your hands. That completes the eye and lip portion of the cleansing. So now we're ready to begin the cleansing of the face. To do so, we are using a milky cleanser just for the sake of movement and not having to hassle with taking off so much product. What's important in this is that you distribute the product throughout the face first before you begin your cleansing manipulations. So I'm going to go ahead over my soil bag and I'm going to pump out about 3 or 4 pumps of cleanser. Cleanser goes back into your table setup and you can see how much cleanser I have in my hand. This was actually 2 pumps. Okay, you're going to go over your soil bag and you're going to emulsify the product into your hands. Beginning at the approach position, beginning in zone 1, the first thing we're going to do is distribute the product. We go back and down, making sure we have product all over the area. We're going to begin in zone 1 our cleansing manipulation using our friction movements. You want to make sure you have enough product on the face so that they can see that there's product. You want to use your facial fingers, which is your ring finger and your middle finger. You want to clean each area in its entirety. So using your friction, Petrasauce, and Effleurase. Moving up to zone 2, which is corner of the mouth to the center of the ear, using some friction. Once again, make sure your fingers are moving over the top of the lip, the bottom of the lip. Move up to zone 3, friction to the temporal. Go to the corners of the nose, up on the glabella, which is the beginning of zone 4. Clean up on the forehead. And when you're getting close to being done, you want to make sure you're distributing that product evenly all over the face. When you're done, you want to go to a pressure point, whether behind the ear, in front, or on the temporal. Apply pressure and release. You're going to open up on your table setup, your paper towel, take out 1 tissue, and wipe your hands clean. Make sure you get all the product off in its entirety. Now we're ready to rinse off the face. To rinse off the face, we're going to use one of our steam towels. Make sure when you use a steam towel that you test the temperature on yourself first before applying it to the client's face. That morning when you go to State Board, make sure that you wet it in its entirety, put it in your kit wet. So let's take our steam towel. We're going to take it out of our soil bag, our bag, and we're going to throw the bag into our soil bag. You're going to have to wring out any excess water, so go over your soil bag and just show that you are in the process of doing so. Your towel is folded, the folded in and the open end. The folded end goes facing towards you. Over your client, you're going to test the temperature. 1, 2, 3. 1, 2, 3. You're going to take the towel, place it onto your client's sin, and you're going to ask them, how is that temperature? You're now going to drop the towel, and you are going to bring it up, leaving exposed the mouth and the nose. And then you bring up this little corner section for the sin. You're going to apply pressure to the face for about 20 seconds without pressuring onto the eye. So just count to 20. And then you're going to begin to remove the product, rolling down the towel and wiping to the temporal. Go down the nose. Go from the corner of the nasal to the temporal. Everything goes up and out. You roll down the towel, and now you're ready to do the corners of the mouth and under the sin. You hold the towel in one place. If you still have remaining product, you can go back and wipe on one side, cover this side, and wipe on the other side. You want to make sure that all the product is off. So check under the sin, check under the lip, the creases of the nose, the nostrils, and bring it all the way back. You're going to roll your towel down, clean under the sin, bring it in front, and then this towel gets thrown into your soil bag, and you want to sanitize your hands. That concludes the cleansing part. Now you need to tone. So we're going to go ahead and take 2 cotton rounds in half, and we're going to use our toner over our soil bag, and holding the lid in our hand, we're going to saturate 2 cotton rounds with toner. Make sure they're well saturated so that they wipe off any residue of product that you may have. Put the lid back on. Make sure all labels are always facing you. Now you go to the approach position. You take your 2 cotton rounds, separate them. Make sure the straight edges are in the middle. Hand over hand, so one hand always has to be on the face, and then the other one to follow. Cupping all the top, you go from zone 1, center of the mentalis, to the auricularis posterior. Zone 2, corners of the mouth to the auricularis anterior. Zone 3, from the corner of the nasal to the temporal. And zone 4, coming up the center of the nose to the frontal, down to the temporal. That is how you tone. Take your cotton pledgets, throw them into your soil bag, and sanitize your hands. Before you complete anything, make sure that your client is draped, everything is clean on your table setup. That concludes the cleansing portion of the exam. Sanitize your hands to show that you have completed, and step back. Our next procedure in the Arizona Aesthetics Practical Exam is massaging the face. We have 10 minutes.
Verbal instructions for setup. You have 2 minutes to remove the supplies from your kit for the massaging the face section of this examination. Please do not begin any procedures until the verbal instructions have been read and you are instructed to begin. You may begin setup.
At this point, the first thing you do is you sanitize your hands. And you are setting up for the massage. And in this case, we're going to take our massage oil and we're going to place it in front. I've completed the setup. I now sanitize my hands and I wait for further instructions.
Verbal instructions. You will now perform the massaging the face section of this examination. You will be observed for client protection, safety, and infection control procedures. You will be given 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Number 1, the instructions will be repeated. Number 2, you may begin. Massaging the face continued. Candidates will be evaluated on the following tasks. Preparation. Removes massage product from container using infection control procedures. Demonstration of massaging the face. Distributes massage product over entire face safely. Demonstrates effleurage movement. Demonstrates petrissage movement. Demonstrates tapotement movement. Demonstrates friction movement. Maintains continuous contact during massage. Removes massage product without dragging or pulling skin. Removes all residual massage products safely. Applies toner or astringent safely. Safety and infection control. Disposes of soiled materials using infection control procedures. Practices infection control procedures safely throughout service. Maintains work area in a safe manner throughout service. You may begin.
Okay, so you've been given your instructions. You have 10 minutes. Our next procedure in the Arizona Aesthetics Practical Exam is massaging the face. We have 10 minutes.
Verbal instructions for setup. You have 2 minutes to remove the supplies from your kit for the massaging the face section of this examination. Please do not begin any procedures until the verbal instructions have been read and you are instructed to begin. You may begin setup.
At this point, the first thing you do is you sanitize your hands and you are setting up for the massage. And in this case, we're going to take our massage oil and we're going to place it in front. I've completed the setup. I now sanitize my hands and I wait for further instructions.
Verbal instructions. You will now perform the massaging the face section of this examination. You will be observed for client protection, safety, and infection control procedures. You will be given 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Number 1, the instructions will be repeated. Number 2, you may begin. Massaging the face continued. Candidates will be evaluated on the following tasks. Preparation. Removes massage product from container using infection control procedures. Demonstration of massaging the face. Distributes massage product over entire face safely. Demonstrates effleurage movement. Demonstrates petrissage movement. Demonstrates tapotement movement. Demonstrates friction movement. Maintains continuous contact during massage. Removes massage product without dragging or pulling skin. removes all residual massage products safely, applies toner or astringent safely, safety and infection control, disposes of soiled materials using infection control procedures, practices infection control procedures safely throughout service, maintains work area in a safe manner throughout service. You may begin.
Okay, so you've been given your instructions. You have 10 minutes. The first thing that you're going to do when they say you may begin is you're going to sanitize your hands. I sanitized my hands over my soil bag and I'm ready to begin. I'm going to make sure that my earlobes are exposed because I do pressure points. I'm going to take my massage oil over my soil bag and I'm going to apply probably about 15 drops of massage oil, not too much because it is a mannequin and it doesn't absorb. Place the massage oil back onto your table setup and emulsify your product into your hands. You're ready to begin. Going to the approach position. The first thing that you need to do is you need to distribute the massage oil all throughout the face. So you're going to begin in zone 1, you're going to distribute to zone 2, zone 3, bring it up the nose, and zone 4. You come back down, and now we're going to do 3 manipulations, 3 times each in its area. Keep it simple, using your facial fingers and always up and out. So we're going to do a relaxing friction movement on the mandible bone, starting in the center of the mentalis, all the way back to the auricularis posterior. Get to the pressure point and hold, hand over hand, 2, and 3. Make sure your fingers are bending and you're using the pad of your fingers to massage. That was 3 frictions. I'm going to do my effleurage. 1, hold. Hand over hand. 2, hold. And 3, hold. Now I'm going to do my petrissage, making sure that my middle finger comes up to touch my thumb, not my thumb going down. So begin on one side. And coming back across to the other side. Making sure that your hand is always under, not over the face. Come back across. So that makes 1. 2. And 1 more. 3. Come back around, circle up to zone 2, and now you're just going to scissor on the lips, doing your effleurage movement. There's not a whole heck of a lot you can do, so you're going to go to the corners of the mouth in zone 2, using your friction movements. And you're going to go to the center of the ear on the auricularis anterior, applying pressure. Hand over hand. 2. And 3. This time I'm going to scissor underwards. 1, 2, and 3. Good to move up to zone 3, corners of the nasal. Good to begin my friction movements from the upper seat, the zygomaticus area, up to my temporal area. Apply pressure, hand over hand, 2, and 3. Now I'm going to do a little petrissage in this area, so I'm just doing some minor knuckling for a little massage. Completing on zone 3. At this point, I'm going to slide up, hit my pressure points on my eyebrow, and bring it around. 1, 2, 3. Going to pinch on the corrugator. Bring it around. And 3. I'm going to do a little effleurage on the frontalis muscle, lifting up on the corrugator and bringing it around and holding. That's 1, 2, 3. Going to do a little friction, circular movements on the frontalis, down to my temporal, hold for a count of 3. Hand over hand. Two, and 3. Just going to do a little scissoring. And 3. Go back to the temporal, and now you want to end into Potemkin's, and you're going to go back down lightly, bring it up, cover all the areas, and end into Potemkin's. Tapping on the face. When you're completed, end with pressure points at the Potemkin's, the temporal, and release. Go under your paper towel, get 1 Kleenex tissue, and wipe off your hands completely. Throw the paper towel into your soil bag and sanitize your hands. Now you're going to take one of your steam towels. You're going to throw your bag into the soil bag, and then you're going to lightly wring out your towel over your soil bag. Once again, we're going to go ahead and fold it in, goes towards you. Open up your towel, test the temperature, count to 3. 1, 2, 3. Test the temperature with the client. Is that temperature okay? Drop your towel and then bring up 1 corner. And bring up 1 corner. You have the center that you want to make sure is brought up. You want to hold for a count of 20. Never over the eyes. So now we're just going to make sure that we take off all of the massage oil. Roll down your towel. Hold one side and wipe the other side really well. Make sure you get behind the ears. Hold the other side. Make sure you get in the nose and under the chin. Just roll your towel. Bring it together and throw your towel into your soil bag and sanitize your hands. At this point, you're going to take 1 tissue and you're going to absorb any excess product Open up your tissue in a triangle form. Bring the tissue over the face and press into those creases to make sure we don't have any product. Bring the tissue around, turn it over. Bring it up. And down. Throw your tissue into your soil bag and sanitize your hands. Now we're ready to tone the face. You're going to take out 2 of your cotton rounds. Take out your toner and saturate it over your soil bag. Put the lid back on your toner, put it back on your table setup, and go into the approach position. Make sure that the straight edges are in the center. Go to zone 1 to the auricularis posterior. Zone 2 to the auricularis anterior. Zone 3 to the temporal. And zone 4 to the temporal. Hold it, put pressure, throw your cotton away, and sanitize your hands. Make sure that everything is nice and neat on your table setup. All products are in order. Sanitize your hands and step back and wait for further instructions. Our next procedure is our manual extractions on the forehead. This procedure has no timing for the procedure, but there is a setup timing.
Verbal instructions for setup. You have 2 minutes to remove the supplies from your kit for the manual extraction on the forehead section of this examination. Please do not begin any procedures until the verbal instructions have been read and you are instructed to begin. You may begin setup.
At that time, the first thing you're going to do is sanitize your hands over your soil bag. You're going to take your extraction kit bag number 5. You are going to open it up and take out everything in the bag and place it under your paper towel. You're going to take your Ziploc bag, throw it into your soil bag, and sanitize your hands. At this point, that is your setup. There is nothing else that you need to do. So sanitize your hands. And wait for further instructions. I stand to be corrected. We need to do the iPads and put our gloves on. So you're going to take 2 cotton pledgets. You're going to take your toner. You're going to saturate over your soil bag. You're going to replace your toner. You're going to go into the approach position and you're going to place on your iPads. This is part of your 2-minute setup. You place one iPad and you place the second one. You come back and you put on your gloves. Remember, sanitizing the hands with your gloves on. Gloves cannot be sanitized, so you're going to not sanitize while your gloves are on during this procedure. So at this point, you stand back and wait for further instructions. This completes your 2-minute setup.
Verbal instructions. You will now perform a manual extraction on the forehead. Do not demonstrate the manual extraction until instructed. You will be instructed individually once you have completed preparation. You will be observed for client protection, safety, and infection control procedures. Number 1, the instructions will be repeated. Number 2, you may begin preparation. Candidates will be evaluated on the following tasks. Preparation. Applies eye protection to client safely. Wears gloves. Demonstration of manual extraction on the forehead. Examiners will read the following to each candidate. Please demonstrate a manual extraction procedure on the forehead. Wraps gloved fingertips with appropriate material, dampened with toner or astringent. Gently applies downward pressure on both sides of pore safely. Uses appropriate material to apply toner or astringent to extracted areas safely. Safety and infection control. Disposes of soiled materials using infection control procedures. Practices infection control procedures safely throughout service. Maintains work area in a safe manner throughout service. You may begin.
Okay, so we're on our manual extraction on the forehead portion. We have already did our 2-minute preparation by placing the gloves on the hand and the eye pads. We're going to take our biohazard bag and we're going to put it on our table setup because our items are going to be disposed because of bodily fluids into our biohazard bag. We're also going to take, we have our antiseptic wipe that we're going to use to clean the area. So let's get ready to begin. The first thing we're going to do is sanitize our hands. Whoops. When you have gloves on, you don't sanitize. So now we're ready to begin. Take out one of the cotton, the little foils with the antiseptic wipe. Throw the paper into the soil bag. Go to the approach position. Hold the skin open. Brace in the area and just wipe the area clean. This can get thrown into the soil bag because it doesn't have bodily fluids on it as of yet. So at this point, we're going to take our 4x4 aesthetic wipes. We're going to use it to wrap our fingers for the extraction. So we have one on each hand. Fold it lengthwise, fold it this way and this way. Now we're ready to begin our extractions. We are going to the approach position, coming to the area. We hold the skin open, so when you approach it, you stretch it open. You press down. So what I do is I demonstrate that I'm pressing down by lifting my fingers. I wiggle and I scoop up to the center and up. I go to the next position, press down, wiggle, and scoop up. Once again, approach position, spread it apart, press down, bring it together, wiggle, and bring it up. At this point, I have completed the extraction. The 4x4s goes into your biohazard bag. Laying on your table setup. At this point, you're going to take a second antiseptic wipe, opens it up, approach, wipe the area. This antiseptic wipe gets into the glove. You remove the glove halfway. You put it into the other hand and you remove the second glove. So your antiseptic wipe is in the glove. You then place that into your biohazard bag. Your biohazard bag now gets double bagged and goes into your soil bag. At that point, you sanitize your hands and you're ready to remove your eye covering. Double brace. Throw them into the soil bag. Sanitize your hands, making sure everything is nice and neat on your table setup, and step back for further instructions. Our next procedure in our Arizona Aesthetics Practical Exam is hair removal of the eyebrows. There is no specific timing on this procedure, but you do have a 2-minute setup.
Verbal instructions for setup. You have 2 minutes to remove the supplies from your kit for the hair removal of the eyebrows section of this examination. Please do not begin any procedures until the verbal instructions have been read and you are instructed to begin. You may begin setup.
At this point, the first thing that you're going to do is you're going to sanitize your hands over your soil bag. You're going to take bag number 6, and bag number 6 has all your items for your hair removal by waxing and your tweezing. You're going to open up the bag, and the ones with the product, you're going to sit on your table setup. So take out the product first, and if it has a lid, it can be set up on your table. If it doesn't have a lid, it goes under your paper towel. You have also a biohazard bag that you're going to set up on your table setup, nice and neat, for the disposal of your blood-borne pathogen contamination. Okay, the rest of this goes under your paper towel. So you have your gloves, your little cup, your 4x4s, your antiseptic wipes, Pelon, after wax remover, and you have your spatulas. So go ahead and your tweezers. Empty that under your paper towel, throw your bag away, and sanitize your hands. Remember, you only have 2 minutes, so work quickly but effectively. Set everything and arrange it nice and neat under your table setup, paper towel. Once you've completed that, sanitize your hands and step back and wait for further instructions.
Verbal instructions. You will now perform the hair removal of the eyebrows section of this examination. You will be instructed individually to demonstrate the tweezing and soft wax procedure. Do not demonstrate hair removal until instructed. You will be observed for client protection, safety, and infection control procedures. The instructions will be repeated. Number 2, you may begin preparation. Tweezing section. Candidates will be evaluated on the following tasks for tweezing. Preparation. Wears gloves. Uses disinfected or disposable implements. Demonstration of tweezing. Examiners will read the following to each candidate. Please demonstrate the tweezing procedure. Applies antiseptic to eyebrow area safely. Holds skin taut without slack. Tweezes or demonstrates removal of hair in direction of hair growth. Applies antiseptic to treated areas safely. Safety and infection control. Disposes of soiled materials using infection control procedures. Practices infection control procedures safely throughout service. Soft waxing section.
Will be read when we get to the soft waxing portion. So we're going to go ahead and begin with the tweezing portion at this time. So we have done our 2-minute setup, and we have during your 2-minute setup, you also may apply your gloves at that time. So now we're ready to begin. The very first thing we're going to do is sanitize our hands. We are going to do the tweezing first. Again, there is no timing, so you wait for your examiner to come in front of you. For the setup on your hands, you're going to place your gloves on. You only need to put the gloves on once because you will go in transition from your tweezing straight into your waxing. You do not need to remove your gloves for each procedure. Okay. So get your gloves on. You are also going to make a little ring for your waxing. You're going to clean the area with your antiseptic, and you're going to have sanitized tweezers available. So the first thing we're going to do is we're going to open up our antiseptic wipe. The question has always come up, do I need to put on eye pads? You do not put on eye pads because they'll cover the area of where you're supposed to be. So you take your antiseptic wipe, go to your approach position, double brace, and wipe the area clean in the brow area. Go to the approach position, throw away your antiseptic wipe, and sanitize your hands. Once again, when you're wearing gloves, you don't need to sanitize your hands, but sometimes just by habit, we sanitize our hands. Now you're going to take one strip and you're just going to wrap it around your ring finger. Take your disinfectant, spray onto the top area, just so you can wipe your tweezers off as you work. Now you're going to go to the approach position. You're going to take your tweezers that have been sanitized and you're going to use them. If you're right-handed, I suggest you tweeze on the right side. If you're left-handed, I suggest you tweeze on the left side. Slowly turn your model's head to the side. You're going to tweeze under the brow area and you'll tweeze until they tell you to stop. You're going to demonstrate. You're holding the skin open. The tweezers have to go between the two fingers. Also, you want to make sure that this hand is double bracing while you're tweezing. The tweezers are going to go in between the hair, and they're going to be yanked out in the direction the hair grows. So again, hold it open, double brace, tweezers go in, and exaggerate that you are yanking it out in the direction the hair grows, and wipe it on your strip. Once again, in, close, yank, in, close, yank. When she says that that's fine, you completed it, you throw your tweezers and your ring into your biohazard bag. Both of those have had the possibility of having bloodborne pathogens, so they need to go into the biohazard bag. You're going to take your new antiseptic wipe. You're going to open it up. And you're going to approach, double brace, and wipe the area clean. That concludes the tweezing portion of your examination. Leave your biohazard bag on your table setup because you're going to go right into your hair removal by waxing. At this time, the examiner will read you further instructions.
Soft waxing section. Candidates will be evaluated on the following tasks for waxing. Preparation. Wears gloves. Uses disinfected or disposable implements. Demonstration of soft waxing. Examiners will read the following to each candidate. Please demonstrate the soft wax procedure. Applies antiseptic to eyebrow area safely. Uses absorbent material or product to dry eyebrow. Removes simulated wax product from container using infection control procedures. Tests temperature of simulated wax product on wrist safely. Applies simulated wax product in direction of hair growth safely. Applies simulated wax product along entire area under eyebrow safely. Applies an even, thin layer of simulated wax product safely. Smooths fabric over simulated wax product in direction of hair growth. Holds skin taut without slack. Pulls fabric in opposite direction of hair growth safely. Applies post-epilation product to treated areas safely. Applies antiseptic to treated areas safely. Safety and infection control. Disposes of soiled materials using infection control procedures. Practices infection control procedures safely throughout service. Maintains work area in a safe manner throughout service.
Okay, so now we're ready to begin. Once again, sanitizing gloves is not necessary. At this point, we're going to begin the hair removal using soft wax. First, we need to prepare our client's skin. So the first thing that we're going to do is we are going to take our antiseptic wipe, open it up, and clean the area. Remember, on both the tweezing and the waxing, we're doing it under the brow. So using your approach position and your double bracing, we're going to clean under the brow. Throw that into your soiled bag, and now we are going to use our powder as our absorbent to lift up any moisture that may be in that area. So over your soil bag, you're just going to apply powder onto your cotton. Close the lid. And I'm going to show you here so you can see, just kind of press it into the cotton, but sure enough, dust off any excess. And you want to make sure that they can see it, but it doesn't have to be a whole heck of a lot. Go to the approach position, double brace, and just kind of pat it in. Throw that into your soil bag and just kind of clean up. Get your wax. You're going to use a disposable spatula and a disposable cup. You do this over your soil bag, but for the purposes of the camera, you're going to open up your wax. And this is a simulated wax of moisturizer. You're going to apply a very small amount onto your cup. Close your container. And put it back. You're going to test the wax on the inside of your wrist for temperature. Place the wax under your paper towel until you're ready to use it. Now you're going to take your wax and wait for the examiner to come in front of you to give you the directions. You're going to take the wax, put it onto a clean Pledsit. Put your wax container, because there's no lid, back under your paper towel. And now you're going to apply your wax. Turn your model's head, come under, and you're going to apply it in one nice, long, even stroke. Make sure that it's evident that you can see that there's wax there. Throw away your spatula. Take out one of your Pellon or muslin strips. Go to the approach position and double brace. Apply the Pellon. Hold at it 3 times in the direction the hair grows. Now to remove it, you're going to take and hold the strip. You're going to hold the skin taut, and when you remove it, you're going to remove it down towards the other ear, not up. So you're going to do it in a quick yanking motion, and make sure you rub it in really good, and remove it and apply pressure. You're going to throw your muslin strip into the soil bag, and now you're going to take a cotton Pledsit. You're going to saturate it with your after wax solution to clean up any wax that may be remaining on the skin. Go to the approach position. Double brace and clean the area. Throw away the cotton Pledsit, and now you're going to apply your antiseptic. Approach position, double brace, and that goes into your biohazard bag. Now, if you chose, you can throw everything into the biohazard bag. It's up to you, but really you only need it when the blood is apparent. Close your biohazard bag after you throw it in and remove your gloves. Your gloves go into your biohazard bag once again. and your biohazard bag goes into your soil bag, which is called double bracing. At this point, make sure that everything is nice and neat on your table setup. I do not recommend throwing your products away, only because you want the examiner to see that you did have and did apply all of these products. When you get ready to go into your next procedure, then you can get rid of them. That concludes your hair removal. So sanitize your hands over your soil bag and step back. Our next procedure for the Arizona Aesthetics Practical Exam is our facial mask. You have 10 minutes.
Verbal instructions for setup. You have 2 minutes to remove the supplies from your kit for the application of the facial mask section of this examination. Please do not begin any procedures until the verbal instructions have been read and you are instructed to begin. You may begin setup.
Okay, so at that point, you will sanitize your hands. And your preparation is to take bag number 7, labeled mask bag. You're going to open up your mask bag. Under your paper towel, you're going to put your mask cup. You've got your mask product labeled mask, and you have your implements. Your implements will go under your paper towel, which is your spatula and your mask brush. At that point, you're in your setup, you throw your bag away, you sanitize your hands. At this point, I also clear my table setup, I throw away my wax products, and I sanitize my hands. Part of your preparation in this is to go ahead and remove the mask using your spatula from its container into the smaller container. So to do so, you open up, you give it a little bit of a mix just to warm up the product a little bit. And you go ahead and you apply the product into the second container. You throw away your spatula, close the mask product, and put it on your table setup. Put the cup underneath your paper towel. That concludes your 2-minute setup. Sanitize your hands, step back, and wait for further instructions.
Verbal instructions. You will now perform the facial mask section of this examination. You will be observed for client protection, safety, and infection control procedures. You will be given 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. The instructions will be repeated. You may begin. Candidates will be evaluated on the following tasks. Preparation. Removes mask product from container using infection control procedures. Demonstration of facial mask. Applies mask product over entire face safely, excluding eyes, lips, and nasal passages. Applies mask evenly and safely. Removes all residual mask product safely. Applies toner or astringent safely. Applies moisturizer safely. Safety and infection control. Disposes of soiled materials using infection control procedures. Practices infection control procedures safely throughout service. Maintains a work area in a safe manner throughout service. You may begin.
Okay, so the first thing that we're going to do in our facial mask application is we're going to sanitize our hands. Our mask has already been in our 2-minute setup, placed into our mask bowl. So I'm looking at my client. Some of the things that I want to do is I want to redrape her so that I do not get mask all over her headband. So I'm going to bring it as close as possible to the hairline. Okay. I am going to take my mask and my mask brush, and I'm just going to load up my mask brush with a product. The easiest way to do this is going to be nice, long, even strokes. Make sure that you do not get it in the nose or in the hairband. So let's begin. I have loaded up my brush. I'm going to put my bowl back under my paper towel. I'm going to my approach position, and I'm going to keep one hand on there. I'm going to start on the mentalis, and I'm just going to go in nice, long, even strokes. Make sure that you get really close to the ear area. Come up around the mouth, but not on the lips. Close to the eye, but not in the eye. Close to the hairline, but not on the headband. Down the center of the nose, along the sides of the nose. And you want to make it noticeable. Never drag down, straight down. You can come out and around. The object here is to get a nice thick coating of mask onto the face. So now I'm going to load it up again. And I'm going to do the other side. Put it back under the paper towel. I'm using my other hand. And I'm just doing nice, long, even strokes upward. Once again, you want to get as close to the mouth, as close to the ear. And I'm just holding her head steady up on the forehead area. This isn't an easy task because we're not using real person skin. So it's just moving on top of the skin. Go to the other side and just kind of clean it up. On the top lip. And close to the eyes on the sides of the nose. Bring it up and around. Nice clean application. Okay, so now you're going to take a tissue, wrap up your mask brush in the tissue so you can get mask all over the place, and sanitize your hands. You're going to take your last steam towel out of its bag, and you're going to wring out the excess water over your soil bag. Fold it in, always facing you. Unwrap it. 1, 2, 3. 1, 2, 3. Test on your client. How's that temperature? And drop. Bring up your first corner. Bring up your second corner. Mouth and nose exposed. And hold for about 10 seconds. Once you've completed that, you're going to begin to remove the mask in the zones that we have done in the previous, just by wiping the mask clean. Bring up one side, and now you can clean the other side. Once again, just rolling and using the towel. Make sure you get in front of the ear, under the jawline, in the creases, and in the nose. Bring that up. Making sure you clean the nose well. And cleaning off any residual. You physically have to go in and look underneath, because you will have product underneath. So at this point, I'm going to throw this away, and in there you have your emergency facial wipes. So go ahead and open it up and take out one of your little wipies, just to kind of get any residual that may be left. Make a little mitt on your hand. And just go in and clean any residual that you may have. Okay, simple. Throw it away, sanitize your hands, and now you have to tone. So now you're going to take 2 cotton rounds, saturate it with toner, put it back, go into the approach position, using your straight edges in the middle, hand over hand, and to bring it back. And this will help to remove any residue of product. Dispose of your cotton rounds and sanitize your hands. Your last task is going to be to apply moisturizer to the face. So take your moisturizer over your soil bag, take a very small amount of moisturizer, emulsify, and you're going to first distribute out, in, out, in. And now you're just going to distribute your product using nice, long, even strokes. Finish off at the temporal. Remove. Take one tissue. Wipe off your hands. Throw away your mask container and sanitize your hands. Make sure everything is nice and neat on your table setup. And now you have completed your mask portion of the exam. Step back and wait for further instructions.